to Dr. Noah's Pro Tandem updates, and we've looked at firefighters and pilots in terms of having problems. One of the things that really comes to heart to me, and I volunteer at what's called Pathway Home. It's a medical facility that works on post-traumatic stress disorder and traumatic brain injuries from Afghanistan and Iraqi soldiers. So I work with Navy SEALs, Rangers, different types of real hard-nosed people that have gotten basically traumatized by what's happened in the war. And so in this article here, it says secondary damage to traumatic brain injury is investigated, and what they will show that post-traumatic stress disorder is a free radical formation and oxidative stress. So that's the beauty, as we've talked about many, many times. Here's a natural substance, 5 herbs, very, very inexpensive, is able to reduce oxidative stress within 30 days, 40 to 70%. This is a must, and I'm trying to get some funding to be able to do that. Another article here, only from Stanford School of Medicine, antioxidant biomarkers and post-traumatic stress disorder. Because the consequences are not just in terms of the devastation of the soldiers there. This happens in sports, this happens in other type of accidents and other type of trauma. Post-traumatic stress disorder becoming a big, big factor. And in this article here from the University of California in San Francisco, having PTSD, post-traumatic stress disorder, increases dementia by 200%. So this has long-term consequences, not only in terms of the personal thing. Last Friday I went to the graduation. So here are these hardest nail type of soldiers, Navy SEALs, Rangers, Green Berets, crying because they're telling about stories because they're so messed up. This one guy's down in the cellar, has a gun in his mouth, and the only thing that stopped him from blowing his brains out because he hears his little baby crying. That's what we're dealing with. That's what we're dealing with in terms of not only just the war of these poor soldiers. And here's something that's been shown to be an effective adjunct in terms of helping them get better, not just giving them lots of drugs. And that's the real issue here. I see in terms of the VA hospital just throwing tons of drugs. So they walk around like zombies. They're totally worthless, and that's not the real treatment here. So Protandim, antioxidant stress is a big, big factor for post-traumatic stress disorder, and another talk we'll talk about traumatic brain injury. So a must.